Good afternoon.
Good afternoon, colleagues. Am I coming across clearly? Okay. So good afternoon. Thanks, Zion, for just sharing the introductory overview of this afternoon's call. Again, my name is Magdalene Matthews. I'm WASH officer here with the regional office, ESARO. And as you know, we are working on a scoping study this year, similar to what we did last year, focusing on WASH in schools. This year, our focus is on WASH in healthcare facilities, specifically looking at enabling environment factors, and we just wanted to have a pre-study Q&A session to allow you to engage with us, to respond to any questions you might have, and also to allow you to get a more in-depth understanding of what we are proposing in terms of methodology. So just by way of agenda, we have just 3 items. This is going to be a very brief call. We'll be focusing on the study overview. We'll open up for discussion on the proposed methodology, and then we'll have a Q&A session where you would be able to ask us any questions based on any challenges you may have so far. So right now, we'll just jump in and run through the presentation, and then open up for questions and answers afterwards. Are we all getting the PowerPoint on your screens? Okay, so I'll just jump right in. All right. So, by way of context, the WHO and UNICEF, through the Joint Monitoring Program, recently launched the first global baseline on WASH in healthcare facilities. And the report was just launched this month. And from findings from the report, we now have a more clearer picture in terms of exact numbers, where exactly we stand around WASH in healthcare facilities. So at the moment, an estimated 896 million people have no water in their healthcare facilities, and 1.5 billion use facilities that have no sanitation. It's on this premise that ESARO WASH, working along with our health and gender colleagues, we're undertaking a deep dive and a scoping study into WASH in healthcare facilities, focusing essentially on enabling environment indicators. The study forms part of our evidence generation and contributes to the regional priorities that we have for 2018 to 2021. And it also comes in response to the UN Secretary General's call to action for WASH in healthcare facilities, which came out last year, March 2018. Okay, in terms of study objectives, we have 3 objectives for this analysis that we're doing. So basically 3 broad objectives. Our first is to assess the status of the enabling environment for WASH in healthcare facilities within the region. We also want to evaluate UNICEF's strategic position in supporting governments to meet the SDG targets, specifically to WASH in healthcare facilities. And we also want to be able to capture lessons learned and best practices from countries within the region for further learning and knowledge sharing. So in a nutshell, those are our broad objectives for this study. We would like to have an understanding of exactly where we are around the enabling environment and the softer component of things. So the JMP report that was issued this month gave us coverage data, so basically access data. So we now have an understanding of what the coverage and access is within the region, but now we want to have a sense of what the softer elements entail around the enabling environment. So that is the purpose for our regional assessment. Now, in terms of methodology, we're proposing going about this in 2 phases. The first phase, to which you have all been privy to, is around a scoping survey questionnaire that we developed and we've shared with country offices. Our regional advisor shared that with the different WASH chiefs, looking at the enabling environment indicators across 36 broad questions. So we'll get back into that a bit in a more detail when we discuss the methodology aspect shortly after the presentation. But for now, we are looking at the study in two phases. The first is going to focus essentially on collecting data through the survey questionnaire tool, which we shared, the SurveyMonkey tool. And then the second phase is actually country visits and site visits to healthcare facilities within 3 countries in the region using the WashFit Indicators Assessment tool. So as part of the email that was also shared by the regional advisor, and for those of you who may be familiar with the WashFit tool, there's an indicator assessment tool that has been developed as part of the WashFit facility improvement tool, and that's what we are using in the field when visiting the healthcare facilities. Now, in terms of expected outcomes, as I mentioned earlier, we would like to get a status update on where we are in terms of WASH in healthcare facilities, looking at it from an enabling environment perspective. And within the WASH sector, we have 5 sector strengthening building blocks, which have been established as part of our enabling environment assessments. The first element looks at sector policy and strategy. The second is centered on institutional arrangements. The third looks at sector financing. The fourth is planning, monitoring, and review. And lastly, capacity development. So if you've had a look at the survey tool that we're using, you would realize that it's structured according to these 5 components. And the questions are being asked under these 5 broad thematic areas. Our second expected outcome is to provide a platform in which countries collectively share and contribute to creating an enabling environment for at-scale WASH and healthcare facilities programming in the region. So we want to get feedback from what's working within the different countries. We want to know what are some of the processes that have been put in place, what has worked, what has been perhaps some of the bottlenecks that have been encountered, what are the gaps, and basically just to get a perspective of exactly where our countries stand in relation to these 5 thematic areas. So everything that has happened around WASH in healthcare facilities within a specific country office is very important to us, because it would help us to know what has worked, what hasn't, and how we can be able to share that in terms of best practices and lessons learned across the different countries within our region. The third expected outcome for the study is to basically generate evidence for more targeted and strategic WASH in healthcare facilities programming in ESARO. Last year, we conducted the WASH in schools scoping study. The report has been shared with country offices in the initial part of this year. And one of the things that we've been able to do is to assess where countries stand in terms of programming around institutional WASH, identify which countries perhaps need a bit more technical assistance and support in specific areas around perhaps sector financing or institutional arrangements, and be able to tailor our support as a regional office to countries within those specific parameters based on the findings of the study. So conducting this study this year on WASH in healthcare facilities will allow us to be able to do that as well, and to also get a general understanding of which countries need more support in those specific areas. So that, in a nutshell, is what the study is going to focus on. We've already started this. In fact, Sion and I made our first country mission to Uganda last week. We were able to visit 5 healthcare facilities in Uganda. We applied the WashFit indicator assessment tool, and we made some very interesting observations in terms of gaps, challenges, and some of the best practices and lessons learned that are coming out from the field. We do have 2 other countries planned within the coming weeks and months, and we will be doing a similar exercise as well in Kenya and also in Eritrea. So in a nutshell, that is just to give you a quick overview of what the study is about, what our aims and objectives are, our expected outcomes. At this point, we would like to just come back to the slide on methodology. We decided to schedule this call essentially to discuss issues around methodology and get your perspective and feedback. And perhaps if you are having any challenges using the SurveyMonkey tool, just to be able to address those. We got a number of emails and questions around the methodology being proposed as part of the study. And so we thought it useful to have this call to just share and provide some clarity on that. So right now, I will open up to the SurveyMonkey tool just to give us an idea. I'm not sure whether that would work. Okay. But anyway, the link is active on the screen. So if you're able to just open it on your PC, you'll be able to go directly to the SurveyMonkey tool. It's pretty straightforward in terms of the questions. Most of the questions are multiple choice questions. So they're either yes, no, to a limited extent, and I don't know. And basically, we are proposing a multi-stakeholder consultation as the format in which we would like to have the information collected. What we are proposing is to have a meeting with UNICEF, WASH, and Health Leading, bringing in partners, CSOs, WHO, the Ministry of Health, and other relevant partners that are working around WASH and healthcare facilities, and having them in a room for a very, very short mini workshop, if you may, to a 2-hour maximum. We did this in Uganda. We were able to get very, very valuable insights from the different partners in the room. And so we're proposing having the different stakeholders around the table and going through the different questions, responding to them. And for every question, we've allowed room for you to be able to provide an explanation. So every question is followed by a comment box which says briefly explain. We would like to strongly encourage our colleagues to kindly provide a bit more detail within the briefly explain comment, because this will help us to gather more evidence around how we frame the narrative for the final report coming out of the study. So beyond just a yes or no or I don't know, it would be very useful for us in terms of developing the narrative from your country office to be able to have just a few sentences on the context and exactly what is happening in the country. If it's a yes, to just share with us your experience. If it's a no, why not? Just so that we're able to capture these different inputs. And having a multi-stakeholder consultation allows for different inputs and feedback. This is a methodology that has been used through, in fact, the JMP when validating data coming from a country office. They usually go about the multi-stakeholder consultation format. We've seen that it's been very useful, and we're strongly encouraging country offices to use this methodology as part of the study. The reason being, WASH in healthcare facility is programming is fairly new in a number of countries. We have partners who are involved, some that have some knowledge on what is going on, and some that may not have the full picture of what is happening in terms of small patches here and there. So we would like to strongly encourage country offices to have multi-stakeholders in the room when going through this, just to be able to capture the perspectives and experiences from the different partners in the room. So I think that was basically the main point we wanted to highlight. We are looking forward to receiving just one final assessment per country. So even though we're proposing having a multi-stakeholder consultation, we are looking forward to having this information compiled and presented in one final SurveyMonkey tool from each country. So here in the region, we will be looking to receiving 21 country folders based on the country assessments and stakeholder consultations that will be done within each country. We also have made provision for attachment of documents. When we did the Washington Schools assessment last year, a lot of the documents were emailed directly. This time around in the SurveyMonkey tool, we've provided space to have that incorporated. So you can just upload the document in a Word or PDF format directly to your final survey questionnaire before submitting it. That would allow us to do additional desk review and have a more in-depth understanding of what the different policies, strategies, guidelines are within your different countries. And we can also have that in order to share with other countries that may be developing standards or guidelines and frameworks within their own country as well. So we would strongly encourage you to make use of that aspect and upload documents to that. Okay, so I think that is pretty much it from my end in terms of the presentation, the overview of the study and how it's structured, and basically what we're proposing in terms of methodology. I believe at this point we move on to an open discussion and questions and answer. And so we will now open the floor to any of you who may have any questions you would like to ask us at this point. Sion, thank you.
Okay. Thank you, Magdalena, for your presentation and clarification. We have one question from Nadia, and the question is, can you share the offline questions in the survey for good preparation? So let's discuss on this and we'll go back then. Over to you, Magdalena.
Okay, thank you. Okay, yes, Nadia, we can do that. We have the survey questions in a Word document. We can share that with you because, again, yes, we realize that this was something that a number of colleagues have reached out to us on, and so we can do that. But what we would just want to clarify is it would be useful if you just use the Word document just for, pre-planning and preparation before the stakeholder consultation. And then the final version that's submitted will now include a compilation of all of the feedback that's coming in from the different partners that you would have in the room. Over.
Thank you, Maggie. The next question is, what is the deadline for the completion of the survey? So over to you.
Okay, so the deadline we've set for the completion of the survey is Friday, the 17th of May. It is quite a period. The survey tool was shared at the beginning of this month, so we basically allowed a wiggle room of up to 5 to 6 weeks for the study, essentially because we know in Southern Africa at the moment we're currently having a level 3 emergency, so we also wanted to factor in the challenges that we're having within the region. So the deadline for submission is the 17th of May. And hopefully we're looking forward to receiving the completed questionnaires by then. So you could just have your stakeholder session, collect all of the information. If you have any other key points that come out and you feel you may not have ample space within the survey to do that, you can just put that within an email and send it to us. If you have any interesting experiences that are shared during this session, we had one in Uganda. It was a very, very enriching experience. We had a number of the CSOs in the room, and they shared so many of their perspectives from the field. So if you have so much coming out from this session, you can just capture it, send it to us by email. Sion and I are both leading on this study here within the regional office, so you can just share that directly with us. And then you can make use of the Word document, which we'll share after here. I can share that now, in fact, if I can just upload it from the Word file and share with you the Word document for the survey questionnaire, which you can use to prep your colleagues and partners before the session. Over to you.
Thank you, Magdalena. The next reflection is in line with Nadia's question, which is the offline document, the anticipated list of attachments, so we can have them ready. If you have anything to say on this, Magdi, over to you.
Okay, thank you. Well, the thing is, the attachments depend on the survey. So if you look at the survey questions, there's a question, for example, on whether you have standards or frameworks or guidelines around washing healthcare facilities within your country. What is expected after that? There's a question on please attach. So basically, we would expect you to be attaching what you have clicked on in the previous question. So the attachments, we don't have a list of predefined attachments because it would depend from one country to the next. There are some countries that have regulatory frameworks. There are other countries that have standards. There are other countries that have only policies. There are other countries that have policies and costed implementation plans. So depending on what governance tool is in place within the country, that is what would define which attachments you would be uploading to the survey questionnaire. So it's not like a list of a predefined expectation that we have. It's based on what is available within your country context. Over.
Thank you, Magdalena. I think these are the one we have now. If you have anything, please let's hear from you, participants, I think.
Okay, Boniswa has responded. Okay. Thank you.
Yeah.
Okay, I think there's another question coming in from Asia.
Yeah, from us, yeah.
Okay. All right, let me just find. Okay, let me just find the survey. Yes. Okay, let me just see if I can upload that here. Okay. Okay. I don't know if everyone can still see my screen. The word? Okay. All right. So basically, I've opened the survey questionnaire in a Word file just to show you what it looks like. My computer is being a bit slow. But so we will share this with all of you. I've already attached it onto Skype here. And just to give you a perspective of what it looks like. Okay, so in response to Boniswa's question, so under part 1, sector policy and strategy, we have a question here that says, number 3, indicate which of the below national documents address wash and healthcare facilities in your country. So you get to tick. It's you have multiple options. If what you have is not there, you can also indicate that here where we have briefly explained, but it's usually either a national policy, a strategy, national guidelines, national standards, regulatory framework. Then you come to question 4, which says, if any, please attach. So basically, our expectation is that based on what you've clicked in question 3 is what you would be attaching down here in question 4. And as I was mentioning earlier, each of the questions are followed by briefly explain. We are really, really looking forward to receiving some feedback from you on this component because it would allow us to develop the narrative around exactly what is going on within the country. So regardless of whether your answer is a yes, no, now being developed, I don't know, we would really appreciate if we could just get, a 1 or 2 sentence brief explanation on what the status is and what the challenges are. So for example, if we look at institutional arrangements, part 2, is there a clearly defined lead ministry for wash and health? it's yes, no, there are multiple leads, or I don't know. Then there's an additional question which says, if yes, specify which department, if no, briefly explain. So if you do have a lead department, it would be useful to just kindly indicate that. If not, to just kindly give us some idea of the context, or maybe give us some perspective on whether this is a gap or not, just so we are able to understand what is going on in terms of the institutional arrangements within your particular country. So that's just the general idea. It follows a similar approach to what we did last year with the wash in schools, where we allowed you to briefly comment on what was going on within your country. And based upon that, we were able to now develop the report, which was shared with all of you. So I think that sort of captures everything. Over to you, Sion.
Okay, thank you, Magdalena. I think that's all we have. So let me say thank you, Magdalena, for the presentation and for all the clarification. And thank you all for your participation, and have a good evening. If you have any concern you want to share with us, you can send us email to Magdalena and me. Thank you, everybody, for your participation. Thank you.
Okay. Thank you all. Thanks for joining in on the call. We've recorded the call and we will share it with other colleagues who may not have been able to join us today. But just to clarify, I'm also sharing our emails here, so you can feel free to kindly contact us directly if you have any additional questions or concerns. So thank you so much for joining us today, and we look forward to receiving your completed survey questionnaires by the 17th of May. Do have a wonderful holiday weekend for those who are observing, and have a good weekend, everyone. Bye-bye.